You're looking for information about potassium bromide and how it helps dogs with seizures. Your dog having epilepsy is stressful, and if you're like me, having knowledge helps me feel like I'm more in control and can make good decisions for my dog. There are great medications out there to help manage seizures, and today we're going to talk about one of them, potassium bromide. Before we get started, I want to remind you that I'm not a veterinarian and this is not medical advice. I'm just a fellow pet owner who has been on this journey with my own dog, Ruby, and I want to share what I've learned. Always talk to your vet about any questions or concerns regarding your dog's health and medication. So potassium bromide is not one of the 3 medications that Ruby is prescribed, but I know it's commonly used and could potentially be an option for her in the future if needed. So it's great to be aware of it. All right, so let's dive into potassium bromide, how it works, the benefits, possible side effects, and what you need to know if your vet has prescribed it for your dog. So potassium bromide is a seizure medication that has been used in veterinary medicine for a long time. It's one of the oldest anticonvulsants and is often prescribed for dogs with epilepsy. It was actually the first anti-seizure drug shown to consistently provide a therapeutic benefit for epileptic people. It can be used on its own, but many dogs take it along with other seizure medications like phenobarbital to get better seizure control. Potassium bromide is not commonly used in human medicine anymore, so standard pharmacies don't carry it. It's primarily used in veterinary medicine, especially with dogs with epilepsy. Because of this, potassium bromide is usually filled through a compounding pharmacy that specializes in veterinary medicines. These pharmacies can make the medications in the exact dosage and form your dog needs. Some veterinary clinics dispense it directly, or they may recommend an online pet-specific pharmacy like Wedgwood, 1-800-PET-MEDS, or Chewy's pharmacy service. There are a lot of other options online that you can Google and compare and figure out what works best for you. So how does this medication actually help control seizures? Seizures happen when there's too much electrical activity in the brain, almost like an electrical storm. Potassium bromide helps calm the brain down by making nerve cells less likely to fire off those excessive signals. It does this by affecting the movement of something called chloride ions in the brain. By replacing some chloride with bromide, it helps stabilize the neurons and makes them less excitable, reducing the chances of a seizure happening. One unique thing about potassium bromide is that it takes a long time to build up in the body, sometimes weeks or even months before it reaches its full effect. So if your dog just started this medication, be patient. It may take you a while before you start to see noticeable results. If your dog is taking potassium bromide, it's important to know that changes in diet, treats, or even salt intake can affect how the medication works. Potassium bromide competes with chloride in the body. So if your dog suddenly starts eating more or less salt, like from switching foods or getting salty treats, it can change how much bromide stays in their system, possibly leading to seizures or side effects. Even swimming in salt water, like the ocean, can expose your dog to extra chloride if they drink water, which could decrease bromide levels and lead to the potential for breakthrough seizures. That's why it's best to keep your dog's diet consistent and talk to your vet before making any changes for food or treats. And dogs on potassium bromide should not swim in the ocean or a salt water pool. Potassium bromide has some great advantages when it comes to seizure control. It's effective for many dogs, especially those who don't tolerate some of the other medications well. It's not processed by the liver, making it a good option for dogs with liver issues, unlike phenobarbital, which is processed by the liver. It can be used alongside other seizure medications for better control. It has a long-lasting effect, so once stable, it doesn't need to be given multiple times a day. Like any medication, though, potassium bromide does come with some possible side effects. The most common ones include sleepiness or drowsiness, especially when your dog is first starting the medication, a wobbly walking or loss of coordination. Some dogs look like they're a little drunk. Increased thirst and urination, increased appetite. Your dog might act extra hungry. These side effects often improve as your dog gets used to the medication. However, there are some rare serious side effects to be aware of. an upset stomach. So some dogs may have vomiting or diarrhea, and they recommend giving your dog potassium bromide with food can help prevent some of those gastrointestinal issues. Behavior changes. Some dogs may seem more anxious or restless. Bromide toxicity. Since this medication takes a long time to clear from the body, levels can build up too high over time, which is why monitoring is important. Your vet will likely recommend regular blood tests to check potassium bromide levels in your dog's system. This helps ensure that the dosage is just right. Too little might not control seizures, and too much could lead to toxicity. Because it takes a long time to reach steady levels in the body, your vet might check blood levels after a few months of starting the medication and then periodically after that. So seizures can be scary, but medications like potassium bromide can make a huge difference in your dog's quality of life. It's easy to administer on a daily basis and works synergistically with phenobarbital if your dog has been prescribed both. It's also relatively inexpensive. If your dog has been prescribed this medication, I hope this video has helped explain how it works and what to expect. If you found this video helpful, please like and subscribe for more tips for supporting and managing a dog with epilepsy. This also helps YouTube push out my videos to others who are looking for more information on canine epilepsy. Thank you for learning with me as I learn with Ruby.